Hi guys, welcome back. I'm Dr. Nupur Khare and I am an internal medicine doctor in Germany, and I'm also a mom of two, and I'm currently rehabilitating from ACL Reconstruction Surgery. So in the previous video I talked about how I got my injury, how it got diagnosed, how I made the decision to go for the surgery, and also the experience of the surgery itself. In this video I will go over how it felt now that I was operated and was back in the ward, and a little bit over how the next few days and the next few weeks look like. So I think it's still hard for me to talk about it because I think this was one of the most difficult days of my life, not because of the surgery but because of after the surgery. When I was back in my room, I was obviously in pain because I was operated upon, and one thing which I should have known, should have been prepared for, but still not quite prepared for, was the fact that I was not allowed to move at all for the first 24 hours. So because of spinal anesthesia, there is something which can happen as a complication, which is called a post-spinal headache. And the one way to avoid it is by not moving at all for 24 hours. And you have to stay on your back, you have to stay flat on your back for 24 hours. So my knee came back in a brace, and I am on the bed flat and I'm not allowed to move. For food also, you are just allowed to raise a little bit and eat as quickly as possible and go back in the flat lying position. And it's not easy. It's not as easy as it feels like. It seems like a very simple instruction to follow, but I don't know, for me it felt really hard because I also started getting backache at some point, and I was not allowed to move on the sides either. One more problem, or one more struggle, was the fact that the new protocol suggests that you should not use any urine catheter because it's a source of infection, which I was completely in line with. I did not want to use a urine catheter either, but they put close to like 3 liters of fluid in you when they're operating you, and now you are back in the ward. You're not allowed to move, and you are a woman, so you can't even use the urine bottles. So now the only option for me initially was adult diapers, because my father and my brother were taking care of me as my mom was with my kids. I just want to forget that that ever happened, and I think it's so hard to be awake and aware and still be in these diapers. And I feel really, I feel the pain of any patient who is immobilized for long and has to use this, because it's very uncomfortable. At some point I kind of, and also, because I was filled with so much fluids, I needed to use the diapers pretty frequently, and I needed to be changed pretty frequently. So until the evening when my friend came, and I asked the nurse for help once, and she helped me with the bedpan, but again it's such a frequent usage that nobody could sustain that level of nursing needs, and I could not use the bedpan as I would have liked to. And then in the evening my friend came and she helped me with the bedpan. Thankfully I have such wonderful friends who I'm so blessed that somebody who is a friend who could come and help me in such a situation. And yeah, so we use the bedpans, and bedpans again are not very comfortable. I'm sorry I'm going on about this, but this was my basic problem in the first day post surgery. The pain is something which you expect, and the pain is something which everybody expects, and hence you keep getting you get the painkillers for it, and you can also ask for more painkillers if you feel like you can't deal with the pain. And I think at some point I made my peace with the pain I was feeling. It was pretty tolerable, and the only reason I kept on telling myself to somehow just sleep, because when you wake up, this at least one of your problems will be solved. You will be able to at least move sideways, and you will be able to sit up. So I somehow slept flat and on my back without any pillows. And in the morning, I waited eagerly for someone to come and tell me that you can move now. And after the rounds, I was allowed to sit up, and life became a little easier after that. Then we had a visit from the physiotherapist, and they kind of told me that before I leave, I would be allowed to use the walker, and that's why I'm expected to leave on my foot. I'm not expected to leave on a wheelchair, for which we wanted to practice a little bit. So I had my brace on, and we had a walker, and they assisted me with the walking. So with that, my second biggest problem of wanting to use the washroom and not the bedpan got solved. I would say that this particular experience was not the same experience everyone else had on my ward, because most of the ACL tears happen with some other injury as well. And mine was an isolated ACL tear. There was no meniscus involved, and hence they asked me to move immediately next day. Again, also because my surgeon is relatively on the aggressive side, and he was pretty confident that I could move. So you have to also see it from that. The goals are also set individually based on what his experience has been like. So next day I could move, and that felt amazing. Before leaving, I was taught a few exercises. So basically, I was in the hospital for 2 nights, and before we left, I was taught the exercises which are mostly isometric exercises for the quadriceps. You put like a towel underneath your thigh, and you press the thigh down. I mean, with not with your hands, with your muscles, you try to press the towel down, and then something similar with putting the towel under your ankle and you press it down. So that was the idea, and I was told that I can now start trying to bend my knee and try to get to 90 degrees in 2 weeks when I would come for the stitch removal. So that was the goal set basically by the physios and by my doctor. And I came back home and I did my quads, and I did my straight leg raises, and every day I tried to push my knee and I tried to flex my knee a little bit. So I think by the end of first week I was still pretty backward. I was still around 45 degrees or something, and that too with the help of my hips, which means I was not making much progress. How I got to 90 was by using gravity, and it was a trick which my ortho friend told me, that you try to sit down the way you would sit on a chair, because that is 90 degrees, and in that gravity will become your friend. So when you visually see that your knee is able to bend, the doubt in your mind that maybe I will break something if I bend my knee will go away. And when you visually believe that it will bend, it will bend. And that did the trick for me, because I sat every day and I realized, yes, my knee is able to bend. It's just I am too afraid of pushing it. And obviously, because this pain, I would like to just take a second and explain, it's not about the intensity of pain. I don't think it's a very, I gave birth. This is not the worst pain of my life, trust me. But this is such an unnatural pain, because I know what muscle cramps feel like. I go to the gym, I train, I have strength trained before. I know what cramps feel like. I know what a tired muscle feels like. This pain is doesn't feel like I've experienced it before. It feels very sharp. It feels like something is wrong. It's that kind of pain which makes you think something is wrong, which it clearly is, but it is so unnatural. So training yourself to push past that pain and still bend your knee, that is a psychological game. I think you can ask someone else to do it for you. You can close your eyes and do it, so you don't have a mental barrier of, oh, this is how much it goes. But those first 2 weeks were so much about just getting this movement back. And walking with a walker and with a brace, again, something people will make way for you. People will ask you questions. It is difficult to walk around and do this because you do want to walk around, you still want to be mobile, you want to get as much of exercise as you can get, because the brace is anyway taking over half the function of your thigh muscles, so there is no other way to train your thigh muscles than to walk. But everyone around me was at least trying to baby me as much as possible, and they were telling me to just sit down, don't move, don't do too much. And it is hard because you want to cave in because you are also in discomfort. And so this juxtaposition of actually being in pain, being sick, being in this position, and then also requiring to push your body to do exercises. These are not like mind-blowing crazy exercises, but these are exercises which you just have to do, and I was told to do them 4 times a day. So it felt like my life is being taken over by this physio, and yet I am I'm not, I'm not mobile. I'm not it's very easy to get impatient in the beginning because it's hard to just push yourself beyond the pain, but it works. So at 2 weeks, when I went for my stitch removal, I was almost at 90. I was doing, when I sit on my hips, then I could do 90 because I think the hip muscles, the hip joint also helps, and it looks like you've reached that goal. When I was on my belly and trying to bend my knee against the gravity, then I could just reach 80, and that is the true sign. I mean, that is the true place where you should actually measure flexion of your knee. And I was supposed to maintain this 90, and I completely believed that I couldn't believe that it would go even 90. So I was very happy to not push my knee anymore for the next 2 weeks. The problem or the complication which they are worried about is if you push too far too soon, then this new ligament can become too loose and the instability will still be there. So that's why you can't overdo also. If you overdo, then the ligament becomes lax, and the entire purpose why you want this new ligament is that you walk around without feeling any instability in your joint. So which is why I was told not to push anymore. But what was told to me where I needed to push was hyperextension, which means, so this is flexion, this movement, like if this is my thigh, this is my leg, this movement is flexion and this movement is extension. So for normal people, the leg also can go a little bit up. And for me, because I think I've been dancing my entire life, a little more flexibility in joints, I can actually extend my knee a lot beyond 0 degrees. And that is where I was told to concentrate, because that is a very unnatural movement but yet natural for my body, and if I don't get that back, I won't be able to walk the way I walk with my normal leg. So that's what we were concentrating on from 2 weeks to 4 weeks, that I get my extension correctly. And for that I was told to practice basically being on my belly with my knees on the bed, but the legs being off the bed, which means the gravity would help kind of make the leg a little hyperextend. And today is the 4th week mark, and I have achieved full hyperextension, and my flexion is still at 90 degrees, a little more than 90 degrees. And I was told to from now on, I can push and try to reach my full range of motion, ROM, in the next 2 weeks. That is the goal. That is the hope, that I reach my full range of motion in the next 2 weeks. So this has been mostly my post-surgery experience. One thing which is very odd, which is very weird, is even on the time, in the moments when I don't feel any pain, I still know there is a knee. I know that my left knee exists. It feels it. I can feel it there. It still feels foreign. It still doesn't feel like it's a part of my life yet. And one thing I forgot to mention was that at 2 weeks mark, the next beautiful thing happened, which was I was told to get rid of the walker and get rid of the brace. And not at the same time, obviously. First we got rid of the walker. First we got rid of the brace, and then we got rid of the walker. I did just one of the help aids at one time, and at some point in the first week of being told to get rid of these things, I was confident enough to finally remove them. I was still using the brace in the night, but today I think I will sleep without the brace, and now the brace is a thing of past, hopefully, in my life. So that is something to celebrate. And it happens at different rates and different pace for people, but I think anyone who has used these things will understand how much of a love-hate relationship you have with with the brace and the walker, because you're able to walk because of them, you are less afraid because of them, and they're also keeping you stable, they're keeping you sane. But you hate it because it's a constant reminder that something is wrong. It's also your body just stays in that one straight leg position. It is not comfortable. But yet when I had to leave them, that gave me the sweats. I had to really take a deep breath when I finally got rid of my walker, and when I finally got rid of my brace. So yeah, the day you get them off, you will really feel that you've accomplished something. And in the past 2 weeks, instead of concentrating on the flexion, I have been concentrating on walking without the brace, and I still walk with a limp. And that's what I will work on next. I will talk with my physiotherapist or with a physiotherapist and try to get my walking as normal as I can. So that's the goal. And then I will fly off to Germany, and then we'll see how life looks like with one leg and one more kind of sort of healed leg. So yeah, looking forward to that. Anyway, I think this is a good place to sign off. I will see if I can do some magic and put the videos of my exercising knee in the corner somewhere, so you can see how it looked. And you might have different set of exercise, you might have a different set of protocol, and you might not reach the goals in the timeline that I did, or you might reach them before. You might have already reached them long before I did. Everybody's path to recovery is different. Everybody's path of recovery takes its own time. There will be 100 people telling you this, but let me be one more voice and say that it's not a straight linear curve. It goes like this, and somehow we all are trying to reach the same place of wanting to go back to the way we were before the surgery happened. So on that note, I will say bye and see you next time.